welcome to the Stroke Recovery Group. I'm so glad you're here. Hi there, thank you so much for joining me again for another I Care for Your Brain Stroke Recovery Group, generously brought to you by the Foundation of First Health. Today we're going to get into rule number 8, but before we do that, we always like to do a nice recap of where we were at last session. So in session 7, I hope you grew in your understanding that your stroke did not just happen to you. It also happened in its own unique way to the people that love and care about you. Rule number 7 was support those who support you. Caregivers often take on their new role with little or no preparation. 98% of caregivers report one or more stressful problems, but also report a greater appreciation for life and often consider their care a true labor of love. The higher your distress, the higher distress of your caregiver. Relationship challenges after a stroke are common and need to be addressed. And we concluded rule number 7 by talking about the importance of showing your appreciation to your caregivers often. We discussed the 3 common challenges for caregivers as managing uncertainty, difficulties managing big anxious emotions, and feeling overwhelmed by a new life and a new role. We talked about the importance of showing appreciation through 3 different types of approach: words, touch, and deed. We also talked about the importance of needing to do better by our caregivers. Psychological interventions for caregivers must be a part of the post-stroke care process to improve caregiver and patient quality of life and well-being. This would include skill development, education, and supportive problem solving. Now let's switch over to rule number 8. Rule number 8 tells us that we must acknowledge our trauma. If we don't acknowledge symptoms of traumatic stress, we miss an opportunity to optimize recovery. A stroke is much more than a physical brain trauma. A stroke is a psychologically stressful event, even traumatic for many. After a stroke, there's a wide range of normal emotions. This can include things like shock, feeling like you can't believe this has happened to you. Fear, feeling more vulnerable naturally leads us to feel more fear. Self-blame, questioning why you didn't do more to maybe prevent the stroke. Guilt, feeling remorse for maybe what's to come for your caregivers. For many people, the stroke was experienced as something very scary and disturbing, and they continue to struggle with anxiety to this day. Sometimes in stroke recovery, we can focus so much on the physical that we don't take time to consider the psychological impact of what's happened. So as part of your stroke recovery and as part of our time together today, I want you to turn over your stroke trauma rock. And what I mean by this is many people who've been through a traumatic event put up a big old wall between them, their memories of the event, their emotions related to the event, anything that might trigger them to feel as if it's happening again. It's very normal to put up kind of a big hard wall between the experience and ourselves. But I want to start off this very important session today by having you ask yourself a question, which is, do I consider my stroke to be a psychologically traumatic event? Maybe no one's asked you that question before. And if you're wondering if it would qualify as a psychologically traumatic event, I want you to look at this definition. The definition of a trauma is any experience that involves the threat of death or serious injury, particularly when sudden or unexpected, that results in intense feelings of fear and or helplessness. Let's go through the 4 symptoms of post-traumatic stress disorder so you can start to consider if maybe this is something that you're struggling with. The first symptom is what we call re-experiencing. And what re-experiencing is feeling in your waking mind or in your dreams that the event is happening all over again. It's a sense of being unable to not think about it. Number 2 is hyperarousal. In hyperarousal, we feel like we're on alert all the time, always waiting for the other shoe to drop. Feeling that it's very difficult to let your guard down and relax, kind of always looking over your shoulder. Number 3 is avoidance, and this is what we all naturally do when we're very overwhelmed by something and it makes us feel very, very tense. This is trying to put it out of your mind, avoiding situations, people, or thoughts that remind you of the trauma. And number 4 is maybe the worst one of all, which is how a traumatic event changes how we feel about things, how we think about things, particularly ourself, the world, and other people. So if you find yourself making blanket negative statements like, I'm not worthy of love, the world isn't safe, I'm not safe, no one can be trusted, I have no future, I'm going to die young, these are indications to us that you have been profoundly affected by a trauma so much that it's changed the way you really feel. So now what I want to do is map those traditional symptoms of post-traumatic stress disorder onto the stroke experience. So let's go through all 4 of those categories again, but now put in specifics that could be related to someone who's had a stroke. So when we look at the re-experiencing cluster, what we can see here are possible symptoms of nightmares, specifically related to the stroke, feeling that your anxiety gets triggered by things like smells, objects, conversations, anything that reminds you of your stroke. For many people, hospitals, sirens from ambulances, the smell of a doctor's office, hearing the whoosh of a ventilator, these kind of things. Also feeling like the stroke is happening again, staying very focused on physical symptoms. So if you had a symptom prior to your stroke, perhaps like a headache, anytime there's a little twinge of a headache again, you might have a very strong rush of physical symptoms. The next symptom cluster is that hyperarousal one, feeling keyed up. So this is a sense of always feeling on edge, waiting for another stroke to happen, constantly scanning your body for any possible symptoms of another stroke, being very easily startled, always feeling tense, feeling like you can never let that guard down. The next one of avoidance, if we think about it with stroke, is avoiding reminders of the stroke. Many people after a stroke do not want to go back into a hospital setting. Trying not to think about your stroke, or even sometimes trying to pretend like it didn't happen. Not wanting to talk about your stroke with people, just wanting to push it under the surface and really not ever wanting to process it. And the last one, negative feelings about yourself, the world, or other people, is feeling very strongly that your future is negative, feeling like your life is over, feeling that nothing good can happen to you anymore, and not being able to imagine the new you post-stroke. So I want you to take some time and think through these symptoms and think if maybe you are struggling with any of them. Research tells us that 1 in 4 of you listening right now would meet criteria for post-traumatic stress disorder if assessed. Stroke survivors interviewed within 72 hours of stroke onset consistently describe a sense of terror. During the hospitalization, a high number of stroke survivors report experiencing extreme anxiety, despair, and shock. In the weeks, months, and years after a stroke, there can be a long-lasting anxiety about the fear of another stroke. That's very common. The impact of the stroke on your overall life expectancy, feeling like you're going to die earlier than you would have otherwise, and fear of losing control of our bodies and our future. Recent research that just came out helped us understand that the severity of post-stroke, post-traumatic stress disorder is related to something called rumination. Rumination is repeatedly thinking about your stroke, the symptoms of your stroke, the causes of your stroke, and the consequences of your stroke. So it's a tricky balance trying to figure out how much you need to psychologically process what has happened to you versus not wanting it to consume you and have it be the only thing that you think about day in and day out. When we think about traumatic stress symptoms, I want you to know that they exist on a spectrum. When I read those definitions to you of the symptoms of PTSD, you don't need to meet every single criteria to be concerned. There may be some days where your coping is very strong and you don't feel that those symptoms interfere with your life at all. And there may be other times when things are very stressful or you get very triggered that you are consumed with feelings of anxiety. But whatever the amount is for you, I want you to know that it is weighing down your brain recovery, and that's why it's so important for us to talk about these symptoms. Traumatic stress symptoms that go untreated are associated with poorer outcomes for you. This means less physical recovery, less return of independence, and reduced quality of life for you and your loved ones. You don't need any additional stress on you right now. You have enough to focus on with this stroke recovery. People with stroke and PTSD rate their overall quality of life as 30 points lower than those without PTSD. So I want you to think about that. On a scale of 0 to 100, when people had stroke and PTSD, they put themselves as 30 points less on the quality of life scale compared to those who didn't have PTSD, but the same degree of stroke. So it's a pretty significant influencer. I also want you to really understand how PTSD affects your brain and your brain function. It basically hijacks your brain. There's two parts of the brain that are intimately involved with PTSD. The first one is in what we call our limbic system, or our emotional center of the brain, and this is the amygdala. The amygdala is one of the oldest parts of our brain, and it's very much focused on threat detection and survival. If anything comes into our world that makes us feel that we might not make it or we're going to be seriously injured, anything that taps us of our resources, the amygdala goes on super high alert. What then happens is that activation in the limbic system part of the brain suppresses or dampens down or reduces the functioning in another part of the brain. And this is the prefrontal cortex, our frontal lobes. And when the frontal lobes aren't working well and they are suppressed, it's as if we have a runaway car that has lost its brakes. And I really want you to think about it like that. And if you've experienced post-traumatic stress symptoms, you understand this. It's almost like you can't push away the thoughts that bother you. It's very hard not to overreact to stressful things in your environment. You're kind of all impulse and no reason. Survival consumes the PTSD brain. It takes up precious real estate. And what I worry about is you then can't focus on important things like your rehab therapies and your adaptation, your adjustment to living after a stroke. When we have PTSD, traumatic stress symptoms, we have less of that important restorative sleep that we've talked about, which means less emotional processing. We are less able to tolerate any additional stressors or frustrations that happen in our daily life. And this can really hurt our relationships. Folks with PTSD are oftentimes very irritable because of how unbelievably overwhelmed that they feel. PTSD also hurts us in terms of our cognition. We have reduced learning and we are less able to make new memories. And essentially that's what this rehab is all about, is you're trying to relearn new ways of doing things, ways of compensating, and you're trying to make new memories of how to build new adaptations and new types of function. What's important for you to know about your stroke and what we're talking about today is that you didn't come into that experience as a blank slate. You were a very complex person before the stroke, and your life history really matters. Your chances of being highly traumatized by your stroke depend in part on your history and how many other traumatic events you've experienced. Trauma is cumulative, and unfortunately, exposure to traumatic life events is not uncommon. So I want you to look at my checklist here, and if you've experienced any of these life events prior to your stroke, you were at higher risk for developing PTSD. The first one is any other near-death experiences. If there were any other times in your life where you felt that your life was at risk or you were facing serious bodily injury, that increased your risk. Any death of a close loved one that was very disturbing or difficult for you, divorce, separation, a painful end to any close relationship, major injury or any other significant medical illnesses, major car accidents, assault of any kind, physical assault, emotional assault, sexual assault, neglect, not getting your basic needs met, particularly as a child, living through a natural disaster, and even significant financial loss, like having to declare bankruptcy at some point in your life. How you were treated by your medical providers in those early acute stages of stroke also really matters, according to the research. During a life-threatening medical emergency, including stroke, your perception of healthcare provider compassion has been found to be associated with the subsequent development of PTSD symptoms. This is perhaps most relevant for those of you who had a posterior stroke. This is a stroke that happens in the back of the brain in a part like the brainstem or the pons or the cerebellum. And this is because you guys didn't have typically stereotyped stroke symptoms. And oftentimes when you go to the ER and you have a balance concern or your eye movements are unusual or dysfunctional, these aren't recognized often enough as a stroke. People are often told that it's a migraine, perhaps questioned if they're intoxicated. And when people feel dismissed, this is invalidating and traumatizing for us. If you have a history of significant trauma, a stroke can just be the final straw of how much you feel like you can cope with. So I urge you to get help if you need it. Although evidence-based treatments for PTSD have been around for decades, including counseling techniques like cognitive processing therapy, there haven't been any controlled clinical trials for stroke-related PTSD as of 2020. So what I wanted to do was put together some of the evidence-based recommendations that we know from trauma treatment in general and help you understand some of the first steps that you can take to start to address this important part of your function. If you can, I want you to find an expert in trauma or neuropsychology in your community to get started on the road to the healing that you deserve. These services are covered by most insurance policies, and when this is not possible due to access or cost, like I said, I wanted to at least give you some evidence-based recommendations to help get you started. The first thing is that you have to stop trying so hard to not think about what you've been through. That's a very normal thing to do. You live through it once. You don't necessarily want to keep reliving it. Unfortunately, this backfires on us, and avoiding your thoughts, memories, or your feelings about what has happened to you will have a boomerang effect and only prolong the emotional work that must be done in order for you to heal. So let's kind of try a little experiment here to make that point come to life. So I want you to look at my slide here, and I want you to see this very unusual pink elephant that we have, okay? And I want you to look at how unusual that nice bright pink hue is, and really take a good look at those big ears and its trunk. And I'm always drawn to looking at elephants' toes. I think they have the cutest toenails. And what I want you to do is close your eyes, and for the next 10 seconds, you absolutely cannot think about this pink elephant. You're not allowed. It's unacceptable. I want you to not think about it. Okay? So close your eyes right now and do not think about that pink elephant. Don't think about it. Not thinking about it. Push it completely out of your head. You are not allowed to think about that pink elephant. Okay, I hope you got my point there. The more we try to suppress something, it's like trying to push a ball down in a bathtub. You can do it for a little while, but it's always going to pop up on the other side. And when it comes up on the other side, it comes up with force. And this is where we think those re-experiencing symptoms come from, that we spend so much mental energy in avoidance. And it doesn't work. It's not effective. It's effective sometimes for a short amount, but when it pops back up, boy, there's a lot of pain there because it's so emotionally charged. But not avoiding your thoughts and your feelings and your memories about your stroke doesn't mean that I want you to open the floodgates. That's actually just as dangerous to you as pretending it never happened. So what we want to do is find that balance between processing, validating, and acknowledging, but we don't want you to become so overwhelmed that you get off track. The very first thing that people who have been traumatized by a life event need to do is start emphasizing themes of safety and security in their daily life. When unpredictable things happen to us, we naturally brace ourselves for another blow. That tension can make us feel very vulnerable and afraid. After a trauma of any kind, we need reassurance and predictability. This is something that's very important, particularly in the hospital, in rehab, in those first weeks and months after a stroke. Caregivers can really serve an important role here, making sure that statements about how safe the person is, that there's a plan for them, knowing that they're always going to have your support and care as they go through this stroke journey is a really important gift that you can give them. I want you to try to keep the most dependable schedule of daily events that you can. Try to wake up at the same time, go to sleep at the same time, eat meals generally in the same time. It's very important for your brain that it knows what to expect and that it has repetition and predictability. I want you to remind yourself often about all of the securities that you do have in life, your home, your family, the food on your table. One other thing that has become popular in the last few years are weighted blankets. If you haven't tried one of these things, they really do work. You can get them in 5, 10, 15-pound increments. You just lay them on your body, and for many people, they give an incredible feeling of security and really promote restful sleep. The next thing I want you to do is work on validating your own trauma. You are the only one who really truly understands what it is that you've been through, and it's so important that you slow down and take some time to give yourself some compassion for all of the struggles that you've had. It's really important that you decide if this stroke was psychologically traumatic for you, and if it was, I really want you to own that. It's okay. It's important for you to say those words because it really validates that it's something that needs to be focused on and healed from. This is a great picture of self-compassion. If you're able to give yourself a hug, I highly recommend that. We often need compassion desperately from other people to feel like our pain was real, to feel like that it was important enough to be recognized by other people. But the truth is, the person that we need the most compassion from is ourselves. And this is often time where that negative self-talk can really undermine our happiness, our quality of life, and your stroke recovery. So I want you to pay attention to how it is that you talk to yourself about this stroke and how it's affected you. I want you to give yourself credit for how far you've come. Once again, you're really the only one who knows how difficult it can be to get through intense therapies, how hard it can be to wake up some mornings, how difficult it can be to face life when things have been turned totally upside down. You have to take time to congratulate yourself in a genuine way for all of the accomplishments that you've been able to do since this stroke happened. And I really want you to start to believe that you can put the pieces back together and emotionally heal. Depending on where you are in your stroke journey, when you're hearing my message today, this might seem extremely overwhelming or maybe even impossible. If you've been at this long enough, you might really understand that this is possible, and you might be very close to truly feeling that in your bones. Wherever you are in your state of readiness to give yourself compassion, to give yourself credit, and to really believe that you can return to a state of psychological wholeness from the stroke, I want you to really keep going with those feelings and thoughts and that intention. Now let's talk about some action steps that you can take once you have that feeling of security, once you've really validated for yourself what you've been through, and once you've really stepped into a state of self-compassion. It's important that you reflect on the deep changes that the stroke has had on you, both positive and negative. This can be done with a mental health professional, a trusted loved one, or even on your own during times of reflections. I want you to identify the thoughts and the feelings that you have about how this stroke has affected you. Sharing these reflections can be a great start for counseling or a healing conversation with someone who really cares. When we don't sit down and put the time into figuring out how we really feel the stroke has affected us psychologically, we have unresolved trauma. And this can often lead to something we call stuck points. And we don't want to be stuck in any aspect of life, especially into stroke recovery. It's really important that we help you to keep moving forward. Negative beliefs in the areas of safety, trust, power, esteem, and intimacy are particularly important for you to uncover as you go through your healing journey. So what I want you to do is take some time now and after we're done today, really reflecting on a few different statements. And I want you to try to answer them in the best way that you can for how you're feeling right now. My stroke has impacted me in the following ways. First, I want you to think about safety, your ability to feel safe in your body in particular. Just spend some time really thinking about how this has changed for you and make a note, share how you feel, or write it down. The next one is in the area of trust. How has the stroke affected how you are able to trust yourself, other people and their intentions, and your decision making? Power. How has this stroke affected your ability to handle the challenges of life? Esteem. How has this stroke changed your ability to feel confident in yourself, in your own body, in your mind, in your spirit? How has this stroke affected your intimacy, your ability to feel close to yourself and other people? As you're going through these techniques, especially if you've been avoiding thoughts, feelings, and the impact of your stroke, it's likely that you could feel a little bit overwhelmed by this, especially if you haven't spent any time really thinking these things through. So I have to help you understand grounding techniques in case you find yourself getting a little bit flooded or overwhelmed. Remember, like I was saying before, we don't want you to completely clam up about this stuff, but we also don't want you to just open the floodgates and be completely overwhelmed. So these are some of the very best grounding techniques that you can use, or as a caregiver, you can have them in your toolkit if you find that your loved one or yourself is just feeling a little bit rattled by some of these reflections. The first one is one that I really appreciate, which is visualizing a dial on your emotions. And when your emotions get a little bit too high, you have the power in your mind's eye to turn them down. Clenching your fists so you can move all of the energy of that emotion into your hands, which you then release. So much of this work is not keeping all of the difficult, dark, painful feelings inside yourself and expressing them, getting them out of you into the world. You can use your visualization and imagine yourself in a very safe place. I have asked many people to do this in my practice, and I've gotten some of the most beautiful responses. Probably my favorite one is a woman who, anytime she would feel overwhelmed, she imagined herself crawling up in a little child's pose into a big hand that she visualized as God's hand. And I just thought that was so precious. You can distract yourself, count backward from 100. You can name everything you see in the room. You can think about something you see, something you hear, something you smell, something you taste. Really try to get absorbed in the here and now. You can imagine that any stressful memories are a movie playing and that you can walk out of that movie theater anytime you want. Know that you can step outside into the daylight and be right here in the present day and no longer in the past. You can imagine that you're a big, strong tree and that you have deep roots growing out of your feet that are connecting you very, very securely to the earth. If at any point you feel overwhelmed by any of the memories related to your stroke, know that you can always count on these techniques to bring you back to the here and now. And once you've done the work of really thinking through how you've been impacted in those important areas in life, you can go back and revisit them in a few weeks or even in a few months. And once you can answer those stroke reflection statements positively, you know that you are no longer stuck in the trauma and that it has lost its power. So when you first start to think about those statements, you might be surprised when you really give it the attention it deserves, how much, for example, your feelings of confidence have been changed. You know, not feeling powerful when you walk into a room, not feeling confident to speak up, not feeling like people take your opinion seriously. Once you can really work on that, particularly in therapy with a skilled mental health person, you can go back and look at those questions again. And it's a beautiful thing to see how far people come in their healing journey to be able to answer those questions more positively and more realistically. Once you go through a healing journey, the goal is really to come out on the other side and feel as if you have had some sense of growth. We call this post-traumatic growth. Trauma, as hard as it can be to experience, can provide us with the opportunity for personal growth, making us an even better version of ourselves. So think about it. Is it even in the realm of possibilities for you to think that the stroke could increase your sense of meaningfulness, satisfaction, and fulfillment in life? There's something called the post-traumatic growth inventory, and I wanted to run through some of these statements with you so you can get a more practical idea of what that might look and feel like if you were to feel that you came out on the other side of this experience better. I have changed my priorities about what is important in life. I can more clearly see that I can count on people in times of trouble. I can better appreciate every day. I have a greater appreciation for the value of my own life. I have more compassion for other people and what they go through. I am better at accepting that I need other people. And I have grown spiritually because of my trauma. I know those statements might feel very far away from you right now, but people who have been through exactly what you have reported that they can feel this way after the hard work of processing, validating, compassion. I also really want you to try to connect with other stroke survivors who understand the personal side of stroke. As much as I care about what has happened to you, it's very important that you understand that I haven't been there. I have not walked a mile in your moccasins, and I really want you to find someone who has to talk about this experience with. Talking about the psychological challenges that you faced with other people who face the very same things is very, very important. It's going to help you understand that your struggles are normal. There's nothing wrong with you, that you are working really hard to get through some of this anxiety. You can learn how other people made it through. You don't have to reinvent this wheel. What worked for them, it might also work for you. I want you to try to find either in-person opportunities like in a stroke support group, in a peer support stroke buddy program in your hospital, or even online forums like Facebook has a lot of stroke survivor groups. Try to find other people who've experienced a similar stroke as you, similar age. The more similar life experiences you can find with someone out there in the world, the more you're going to connect with them and have a greater sense of satisfaction from speaking with them about their experience. So let's wrap up with one of our self-empowerment statements, and I want you to say this alongside me. I will work to process how my stroke has affected me psychologically, and I will seek the tools I need to heal. I hope that you join us next time for rule number 9. This is where we're going to talk about insisting on follow-up care. Thank you guys so much for listening to this important message today. I hope you really take it to heart, because I believe it's one of those factors that can take you from a stroke survivor to a stroke thriver. Thank you guys so much, and I really look forward to seeing you again. Bye-bye.